Hello, welcome back to my channel, and today we will discuss about GIT pharmacology. Today we will discuss about antiemetic drugs that is used for nausea and vomiting. I will classify these drugs in the following. It include 5-HT3 blockers, D2 blockers, H1 blockers, antimuscarinics, corticosteroids, cannabinoids, neurokinin receptor antagonist. The first drug, 5-HT3 receptor blocker, is basically a serotonin receptor antagonist that is used for the inhibition of serotonin receptor. The serotonin receptor is basically present on the terminal branch of the vagus nerve. It also present on the CNS, mainly at a salivary tract nucleus. So normally when enterochromaffin cells of the small intestine release serotonin, so this serotonin will activate the vagus stimulation and cause vomiting. But when we use this drug, it will inhibit the vagus stimulation. So the vagus inhibition will also inhibit the vomiting center and vomiting will be decreased. This drug includes all citron like dolacetrone, tropicetrone and granicetrone. The second type of drug is D2 blockers. D2 blockers are dopamine receptor antagonists, which means it inhibits the dopamine receptor. Dopamine receptor is normally present on CNS and at the terminal of sympathetic nerves. It basically activated by neurotransmitter dopamine. So these antagonists inhibit the function of this receptor, and when it is inhibited, the vomiting center in the CNS is not stimulated, as a result of which the vomiting center in the CNS is decreased and hence control the vomiting. These drugs include like domperidone, metoclopramide, chlorpromazine and amisulpride. The third type of drug is H1 blockers. H1 blocker is histamine receptor antagonist, that it blocks the histamine receptors. Histamine receptors basically present on smooth muscle cells and also in CNS, and its nature is like it's G protein coupled receptor. So it basically activated normally by histamine in response to allergic reaction. So by giving histamine receptor antagonist, it blocks some areas in CNS like postrema and vomiting center, which is present in vestibular nucleus of the CNS. It also blocks the muscarinic acetylcholine receptors, so the central nervous system will not be irritated and it will decrease the vomiting center and hence vomiting will be controlled. These drugs include like diphenhydramine, promethazine, cyclazine and mirtazapine. The fourth type of drug is antimuscarinics. Antimuscarinic is acetylcholine receptor antagonist, that it binds the acetylcholine receptors like muscarinic receptor. So as you know, muscarinic receptor is normally activated by presence of acetylcholine. When we block by giving antimuscarinic drug, so the function of this muscarinic receptor is decreased. So the neurotransmitter like acetylcholine at the synapses in central nervous system and also peripheral nervous system like parasympathetic nervous system will be decreased, and hence there will be decreased stimulation for the vagus nerve, and when there is inhibition of vagus nerve, so the vomiting will be decreased. This drug includes like atropine and scopolamine. The fifth category of drug is cannabinoids, and these are the drugs which is taken from cannabis plant and can also be synthetic from animals. So this drug is basically work on cannabinoids receptors, which is of two types, cannabinoid receptor 1 and 2, and it's mainly present in the brain. So this is the system which we can say endocannabinoid system that regulates the neuronal function, and we can say it's a multi-organ hemostatic system that regulates the function of brain. So when we give this drug, it reduces the function of this receptor, and therefore it will release less amount of serotonin in neuronal synapses. The decrease in release of serotonin into the synapses will help in reduce stimulation of vagus nerve system, and there will be control of vomiting and nausea. So this drug includes like cannabis, Nabilon. Another type of drug is neurokinin receptor antagonist, which inhibit the function of neurokinin receptors. Neurokinin receptors or tachykinin receptors that is present in CNS and peripheral nervous system, and it is basically a G protein coupled receptor. And ligand which bind with this receptor normally is substance P, but when we give this antagonist, it blocks the function of neurokinin receptor, and it's helpful in efficacy of 5-HT3 antagonist. So in this way it will inhibit the peripheral nervous system stimulation for vagus nerve and decrease the vomiting and nausea. Neurokinin receptor antagonists include aprepitant, rolapitant, and nitopitant drugs. After that, we can also give corticosteroids for reducing inflammation and to suppress the immune system. The drug include in corticosteroid like dexamethasone. We can also give prednisolone.